Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, the CDC shortens recommended COVID isolation period. New guidance issued Friday by the U.S. CDC recommends anyone who tests positive for COVID-19 no longer needs to routinely stay home for 5 days. Instead, return to normal activities when, for at least 24 hours, symptoms have improved overall and if fever is present, gone without the use of a fever-reducing med. This is the first time the agency has loosened COVID isolation guidelines since 2021 and brings a unified approach to addressing risks from a range of common respiratory viral illnesses such as COVID-19, flu, and RSV. Once returned to normal activities, still take precautions over the next 5 days to help stop the spread of infection to others. Enhance hygiene practices, wear well-fitting masks, social distance, and get tested for respiratory viruses. Get your vaccinations, boosters, and treatment. Most importantly, stay home when sick, cover your coughs and sneezes, wash and sanitize your hands often, clean frequently touched surfaces, and seek clean air by bringing in fresh outside air, purifying indoor air, or gathering outdoors. New isolation guidance for COVID-19 excludes nursing homes. New recommendations do not apply to healthcare settings such as nursing homes. Providers urge elders more at risk for adverse outcomes from COVID-19 to stay vigilant and take precautions to protect themselves and others in the community. For continued defense, follow new guidance and get updated vaccines. The CDC continues to evaluate the impact of respiratory viruses on communities and evolve guidance based on that data. Make every effort to educate, encourage resident and staff to get vaccinations as an effective form of protection to reduce hospitalizations and death from COVID-19. Next up, providers increasingly on hook for employees' drug thefts. Violations of the Controlled Substance Act, including staff who divert resident medications for themselves, may open providers up to additional False Claims Act liability. When diversion is discovered at a healthcare organization, the government no longer takes view it should simply focus on potential prosecution of the diverting employee. Instead, demanding answers on how diversion occurred, when discovered, focusing on organizations' record-keeping, security, and reporting practices. Compliance failures could be connected to false claims allegations eventually, becoming more costly for providers. Drug diversion cases in nursing homes are not rare. A study last year reviewed 107 reported diversions in LTC facilities in Minnesota alone and noted the theft is an overlooked form of elder abuse. On average, more than 30 tabs per resident were stolen, commonly oxycodone, hydrocodone, tramadol, hydromorphone, and morphine. The idea makes providers employing the diverter susceptible to enforcement action and increased threat of being sued for hundreds, thousands, or millions of dollars for failing to follow regulations allowing billing of Medicare and Medicaid programs. Safeguards must be placed, access limited, and audits to ensure compliant and sufficient. Bill that cuts nursing home red tape kicks up collaboration with Regulators Advances. An Iowa bill could lead to fewer on-site complaint surveys and more collaborative training programs between the nursing homes and state regulators. The new bill gives state regulators more discretion in cases surveys can be conducted remotely or where repeat complaints about the same issue come in within the consecutive 3 months. Passed on February 26th, House File 2585 is the latest effort to address nursing home quality complaints by increasing cooperation with the LTC sector. The bill streamlines processes, allowing departments to deploy technical and critical thinking to increase efficiencies in the process. Remote surveys, speeding up the process, freeing up valuable time for regulator and provider alike. Necessary on-site investigations will still happen per federal law and mandates twice-yearly training sessions in which inspection agencies would discuss at least 3 of the most common citations in nursing homes each year. Regulators would have to develop new processes to identify top complaints, patterns, and outcomes surrounding them. This will promote consistency in regulatory expectations and identifying trending areas of concern so that providers can better equip staff to proactively review QI protocols for compliance. And finally, healthcare organizations urge federal intervention in wake of cyberattack. The recent cyberattack on Change Healthcare has led to major problems for LTC providers, especially nursing homes with claims, process, and billing. Because of the major stress on the industry, the American Healthcare Association is urging federal action. The organization sent a letter to the U.S. Department of Health and Human Services Thursday, requiring action, like enabling access for advance payments and facilitating better communication on the situation. Timely payments are essential for facilities to maintain daily operations. Currently, CMS allows for advance payment eligibility under highly exceptional situations. They should also provide assessments on a tax impact, advising state health departments about challenges that SNFs now face, encouraging Medicare Advantage plans to provide a form of advance payment option as well. Overall, the attack resulted in Change Healthcare systems shutting down, affecting interconnected platforms, and is expected to take at least another month before the systems come back online. Find more info on these stories at mcknights.com. Thanks for joining News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.